Have you ever heard someone say he looked completely fine yesterday and then suddenly had a stroke? That sentence shocks families every single day because the truth is a stroke rarely appears out of nowhere. In many cases, the body whispers before it screams. The brain sends warning signs hours, sometimes even days, before the attack happens. But most people ignore them, thinking it's just stress, tiredness, or age. Imagine waking up one morning and feeling slightly dizzy. Your hand feels strange for a few seconds. Maybe your speech becomes unclear for just a moment, then returns to normal. Most people would brush it off and continue their day. But according to neurologists, these tiny episodes can be temporary interruptions of blood flow to the brain, often called mini-strokes or transient ischemic attacks, and they can be one of the biggest red flags before a major stroke occurs. One of the most dangerous warning signs is sudden weakness on one side of the body. A person may notice their arm feels heavy, their face slightly droops, or their leg suddenly loses balance. Sometimes it lasts only a few minutes. That's what makes it so dangerous. People think, I feel better now, so it must be nothing. But the brain remembers every second without proper blood supply. Another common signal is unusual vision problems. Some people suddenly lose vision in one eye for a brief moment, almost like a curtain moving across their sight. Others experience blurry vision or double vision. This happens because the blood vessels supplying the eyes and brain may already be narrowing or becoming blocked. Then there's speech. A person may suddenly struggle to find simple words, slur sentences, or become confused during a normal conversation. Family members sometimes notice it before the person does. They may laugh it off, but medically, this can be one of the clearest warnings that the brain is under stress. Doctors also warn about sudden severe headaches that feel different from normal headaches, especially when combined with dizziness, nausea, or trouble walking. In some cases, this may signal bleeding in the brain or dangerous pressure changes inside blood vessels. And here's something many people do not realize. Strokes often develop silently over years. High blood pressure, diabetes, smoking, poor sleep, chronic stress, lack of movement, and processed foods slowly damage the blood vessels day after day. Then one morning, the blockage finally becomes critical. That's why prevention matters so much. Simple habits can lower the risk dramatically. Controlling blood pressure, walking daily, sleeping properly, drinking enough water, reducing excess sugar and salt, and getting regular medical checkups after the age of 50. These small actions may protect the most important organ in your body, your brain. If you or someone around you suddenly shows facial drooping, arm weakness, speech problems, confusion, or loss of balance, never wait to see if it passes. Every minute matters during a stroke. Fast treatment can save brain cells, prevent disability, and even save a life. Your body often warns you before disaster comes. The question is, will you recognize the signs in time? Take care of your health, stay alert, and never ignore unusual symptoms. And if you found this information helpful, don't forget to subscribe to the channel and share this video with someone you care about. Stay healthy and take care of yourselves.